For this case study on integumentary disorders, I'm going to be talking about malignant melanoma, which we know is a very dangerous form of skin cancer. Initial history. We have a 39-year-old white male that has very fair skin. He has a history of numerous nevi, or moles, since childhood. He presents to his doctor with a large, dark, irregularly shaped skin lesion on his mid-back. He's a physical education teacher, and he has a positive family history of dysplastic nevus syndrome. Dysplastic nevus syndrome is a cutaneous or skin condition that can occur in certain families, and it's characterized by unusual nevi that are present and possibly multiple inherited melanomas. So what I could say then is a dysplastic nevus is a mole that looks different than most moles. So it might have irregular borders, be a mix of different colors. It might appear larger than other moles. And they're considered, at least at that time, benign, so not cancerous, but having a fair amount of these dysplastic moles or dysplastic nevus, or I can say nevi, would be increasing someone's risk of developing melanoma. Upon physical examination, a 5-millimeter irregularly shaped darker lesion in his mid-back was noted. Moderate sun damage was noted on his face, neck, chest, and back, and that really indicates that if there's sun damage, that he's probably exposing himself to the sun without protection, whether it's a hat or maybe he's wearing no shirt outside and not wearing sunscreen. His skin had numerous moles present as well as freckles. Looking at his conjunctiva and retina bilaterally, no lesions were noted. There was no supraclavicular, cervical, or axillary adenopathies, so making sure that the lymph nodes were not abnormally enlarged. The lungs were clear to auscultation, so listening and percussing. No liver enlargement, and his strength and reflexes were normal and equal bilaterally. The doctor took a sample or a biopsy of this dysplastic mole and sent it to pathology, and the results indicated what's referred to as a superficial spreading melanoma. So this is his diagnosis. A superficial spreading melanoma is the most common type of melanoma. So this form of melanoma will spread superficially, and then it can start to proliferate later more deeply into the skin. Clark level is a staging system that describes the level of anatomical invasion of the melanoma on the skin. And so remembering the different layers of the skin surface, epidermis, dermis, and then the hypodermis, you can see that level 1 melanoma is confined to the epidermis, that outer layer of skin. Level 2 is starting to invade into the dermis. Level 3 invading further into the dermis. Level 4 really right through the deepest level of the dermis, and then level 5 has invaded the fat, the subcutaneous fat that's found underneath the dermis. And then Breslow depth is a measure of how far a melanoma has invaded the body, and knowing the depth of the melanoma can be helpful because of considering this with treatment. So you can see millimeters is used to determine depth of melanoma through the different layers of skin. Now I've introduced this to you, but these are not always used. Really, the most common staging system for melanoma skin cancer is the TNM system, tumor, nodes, metastasis, which you would have learned about in the topic of cancer in pathophysiology. But still going on with the Clark level and Breslow depth, combining the information that you get from Clark's levels and Breslow scale can help determine the staging of this person's cancer. And if we look at Breslov scale here, you can see that depth and thickness indicates 5-year survival rate. So the thicker, and it makes sense, the tumor is, the reduced prognosis for 5-year survival. So catching it early before it starts to spread can make a big difference. And obviously, in most cases, the level of invasion will also contribute to the person's prognosis. In terms of surgical management and results for this patient, there was wide local excision done to ensure that you're getting all of that tumor, and a sentinel lymph node biopsy was done. The sentinel lymph node is the hypothetical first lymph node of a group of lymph nodes that would drain cancer. And so assessing whether or not the sentinel lymph node has any cancer cells in it can be an indication of spread. Biopsy of the tumor of the suspected melanoma did show that there were some cancer cells present. Lymphoscintigraphy results showed that there was a hotspot identified in the right axilla, which is the armpit. This process here helps evaluate the body's lymphatic system for disease. So they use a small amount of radioactive materials called radiotracers that can be injected into the area to see what lights up or creates a hot spot. And his lymph node biopsy was negative, so that's a good sign. The key with malignant melanoma, aside from preventing it in the first place, is being aware of anything that appears unusual on your body and having it looked at and assessed, and sometimes even pushing to have something assessed if you're concerned with it, because if you catch it early, the prognosis can be great. If you catch it late, it can be poor. So try your best to protect your skin and encourage others to do so as well by either staying out of the sun or covering your skin as best as you can with clothing and wearing a hat and or wearing sunscreen. Bye for now.